My name is Dr. Phani Krishna. I'm a gastroenterologist and a liver pancreas specialist and liver transplant surgeon. Today, we'll be discussing a bit about responsible and smart drinking. That is, how to keep your alcohol consumption in safety limits. So, first thing, before I discuss this, I'd like to state that alcohol consumption is injurious to health. Alcohol consumption, as a gastroenterologist, I know that we deal with patients who have ruined livers. Alcohol affects your liver. Alcohol can completely damage the pancreas, acute and chronic pancreatitis. Alcohol can affect your brain function. Alcohol can affect your kidney. Alcohol can increase the risk of smaller problems like gout and major problems like cancer. In addition, alcohol is a very calorie rich drink. So, and also many times alcohol is consumed, when you consume alcohol, you consume fatty foods. So this rich calorie diet leads to obesity, diabetes, hypertension, high cholesterol, heart attack risk and all that. So despite all these, now consuming alcohol has become a very widely pursued social custom, be it in the cities, the villages, the rich, poor, Indian society, Western society, everywhere it's there. So are there any smart ways by which we can track our alcohol intake? The traditional criteria which try to set the limits, safety limits for alcohol, would talk about 4 standard drinks per day or 7 standard drinks per day. This can be pretty confusing because what is a standard drink? In the market, you have a huge variety, a never-ending variety of alcoholic beverages. From there's probably 100 varieties of wines to beers to rums and liquors, and so it's a huge variety. And the volume consumed by every individual differs. So the standard drink is a very difficult definition to track and follow. A more simpler system, which I'll try to explain today, is by the unit system. The unit system is something which you can actually, when you're consuming alcohol, you can simply calculate on a simple calculator and keep tracking your alcohol intake. So what is 1 unit of alcohol? It is equivalent to about 10 ml of alcohol or 8 grams of alcohol by volume. So that is the amount of alcohol your liver could probably process in an hour or two. So the upper limit of safety of alcohol consumption is about 14 units of alcohol per week. So that is the upper limit in an adult. And this 14 units of alcohol consumption in a week has to be spread out over a minimum of 3 days. If you drink all the 14 units in one day, obviously it's going to be extremely harmful. It's going to affect your mental function. It can lead to seizures. It can lead to severe gastritis, pancreatitis and such. So the 14 units of upper limit per week has to be consumed over 3 days. And people who are regularly consuming alcohol, if you say that no, I want to consume 14 units every week, then you have to have several alcohol free days in between, several alcohol free days. So on every alcoholic beverage, you have the ABV, that is the alcohol by volume. It'll be some drinks like beers and all could have some 4%, 7%, wine could have 15%. There are some drinks which have 30% as well. So the absolute alcohol by volume into the volume you're drinking divided by 1000. So that will give you the number of units. For example, let's say I'm drinking some sort of alcohol which is about beer. Let's say a beer which has 5%. Now the bottle says about 5% is the ABV, alcohol by volume. If 5% I'm drinking 600 ml that day I've drunk, divided by 1000, that becomes 3 units. So 600 ml this thing of 5% lager, if you drink, it takes off 3 units, and you can have maximum 4 such drinks in a week. There's another caveat. We have to remember that most of these are Western standards. The 14 units and all are Western standards. And the Indians we are metabolically different from the West. We have the syndrome X, or the metabolic syndrome you would have heard of. Especially Indian men are more prone to central obesity. We're more prone to diabetes, more prone to the fatty liver and all that. So all those issues are there. So in the Indians, especially the patients with these conditions, if you're a diabetic, if you're more than 45 years of age, if you're obese, if you have fatty liver, and if any of these high cholesterol, if any of you these conditions are there, then you should preferably stop alcohol, and if you drink alcohol, it should be less than 10 units per week. So it should be less than 10 units per week, and again spread out over multiple days. Avoid binge drinking. Then there's another group of patients. If you have alcohol related problems, that means you have alcohol related liver disease, alcohol related pancreatitis, you've had a liver transplant, or if your physician or your doctor has advised you to avoid consuming alcohol, in that case, alcohol is a strict no-no. You have to absolutely stay away from alcohol, because it could be like something like pancreatitis or a liver disease patient. He may stay off alcohol for 2 years and he restarts alcohol consumption. He'll again have the problem. So to summarize, alcohol consumption should be avoided. If consumed, patients without major health issues only should consume alcohol. If you're doing that, patient the safe upper limit is about 14 units per week, and in that also, if if you have the previous problems like diabetes, obesity, and other issues which we discussed, then it should be less than 10 units per week. And using the simple formula on your basic calculator, the absolute alcohol by volume into the volume you drink divided by 1000, you can actually track the amount of alcohol you have every week and keep your liver healthy and stay healthy. Thank you.